Hi, so I'm David and I'm a physio professional. So today I'm going to be talking about people that have discomfort with walking, stairs, going for hikes, cycling, and getting it up and down from chairs and cars due to hip and knee discomfort. So if this has been going on for longer than 2 weeks and it's been getting worse, then it's definitely time that you saw a physiotherapist. Today I'm going to go through a really thorough examination of what people should look at if you have hip and knee discomfort that's affecting your activities. So probably the most important part of hip and knee and ankle pain is how much the knees bend and straighten. So the first most important part of this movement is making sure that you can straighten your knee all the way. So if you can't straighten the leg all the way like this, then you're going to have a lot of difficulty with trying to walk because you're not going to be able to put your weight through the muscles, which then means you're going to overwork your quadriceps, which is this muscle. The next important part is that you should be able to get a 90-degree angle between the hip, the knee, and the ankle. If you can't get that, then you're going to have a lot of pain with trying to stand up from a chair, sitting in a car comfortably, and then getting out of a chair. Another important part of range of motion is your hip range of movement. So an important part of this is being able to bring your knee up in front of your body, and you should be able to at least get your knee up to where my hand is. So that's what we're going to look at now, and that's part of the big 10-point assessment. So if you can't reach this point, you're going to have difficulty with stairs, walking, and also getting changed because you need to be able to get up that high to be able to do all of those things. Another important part of this position is making sure that you can have your legs straight. So if you already have difficulties with knee range of movement and being able to get that straight, you're going to have difficulty here. But if you can't have your hip, knee and ankle all on the bed at the same time, then that means you're going to have a lot of difficulty standing, and a lot of your pain's going to come whilst you're in a standing position and also standing up from a chair. A really important thing to look at if you're suffering from hip and knee discomfort and it's affecting your quality of life is looking at you walking. Often what we see with people that are suffering from knee pain and discomfort is that we see that their knee drops inwards each time they step, and they wait there because they're not able to control those muscles in their knee and their hip, and they're not strong enough to support their weight through their walking. If someone can't straighten their leg and have a straight line between their hip and their ankle when they're standing on that leg through the center, then they're not going to be able to put their heel down on the ground because their knee's going to stay bent. Another important thing to look at is making sure that the feet are behind the bottom when they leave the ground. So that's a good indicator of being able to get a good push off, and is often impacted by hip discomfort and pain. So what do we do with all the information that we've just got from the assessment? Well, the first thing is we look at range of movement, because there's no point in strengthening if you can't get your knee in through the ranges or the hip through the ranges that we need to strengthen. So the research is out, and squats are fantastic for hip and knee osteoarthritis. However, a lot of people that we see aren't strong enough to go straight into squats exercises. So it's really important to start building up through the functional areas first. The last thing that we do is look at your biomechanics, making sure that you're not overusing muscles just from the way that you walk or the way that you're going upstairs or doing your squats to get for your cleaning. So that's the really important stages, and we call them the 3 stages of physiotherapy for hip and knee pain. That's really important to go over.